Hi, good afternoon. This is Dr. Anil Kumar M.R, Consultant Radiation Oncologist, Chairman and MD, Oncoville Cancer Hospital and Research Center, Bangalore. Today I am going to talk about the introduction of radiotherapy, like what is radiotherapy, where it is used, what are the types of radiation, the side effects, what are the different modalities of delivering radiation. So coming to the first question, like what is radiotherapy? So radiation is the medical use of ionizing X-rays, like high energy X-rays, to kill the cancer cells. So that can be in two different forms. One is external beam radiotherapy, that is we use a machine called linear accelerator which delivers instantaneously whenever we require radiation, and we use those X-rays to kill the cancer cells in the particular patient. That is called as external radiotherapy. That is the first type. The second type is internal radiation, also called as brachytherapy, where the radioisotope directly enters the tumor containing cavity or the surround in and around the tumor containing area and delivers radiation for a specific period of time. This is called as brachytherapy, also called as internal radiation. So these are the two different types of radiotherapy. What are the different techniques of radiation? So the good olden days we started with the two-dimensional radiotherapy using the cobalt machines, but in cobalt era we had a lot of side effects with radiation therapy because there was no conformal way of delivering radiation. Just we used to put 2 fields or 4 fields of radiation. In that era we had a lot of side effects with radiation. Now with the advent of CT scans and linear accelerators, we can cone down the radiation beams and hit the specific area where we want to target the radiation. The different modalities of these three-dimensional radiation is 3D CRT, IMRT, IGRT and rapid arc or SRS and SPRT. The more precise the technique, conformally we deliver radiation only to the target, and the normal tissues are being less affected, and hence the side effect profile comes down with the high-end radiation techniques called IMRT, IGRT, rapid arc and the others. But the best way of delivering radiation would always be brachytherapy, where the isotope directly enters into the tumor containing cavity, and hence the surrounding normal structures in and around the tumor area always is spared. So but brachy can't be used for all the patients, but it is only indicated in specific areas only. So this external RT is used in different forms. At least 60 to 70% of cancer patients require radiotherapy as a part of the treatment journey. Like for example, carcinoma of breast, patient undergoes surgery followed by chemotherapy and requires adjuvant radiotherapy depending on the risk profile. Like this, radiation is used in different intent. That is, one is curative, where definitive intent we try to give radiation for head and neck cancers or cervical carcinomas, where radiation and chemotherapy is combined together, or as a secondary adjuvant treatment like carcinoma of breast or carcinoma of head and neck area, where we operate and secondarily we give radiotherapy to prevent reoccurrence of the disease. So this is the curative intent of radiation. And in palliative settings, for example, brain metastasis, we give palliative radiotherapy, or spine meds where there is pain or there is the verge of fracture of bones, we try to give radiation and to strengthen the bones. So these are the two different intents of delivering radiotherapy. Now after discussing the radiation, the types and the intent of treatment, now we'll discuss about the side effect profile of radiation. Side effect is normally we classify into acute and late side effects. Acute side effects is something which happens during the treatment profile. The general side effects of radiation are fatigue, weakness, vomiting, nausea. But the site-specific side effects depends on where we irradiate. For example, if we irradiate the head and neck area, patient gets mucositis or skin darkening. And if we irradiate the pelvic area, we get burning micturition and difficulty in passing urine and difficulty in passing the stools, and some amount of diarrhea can also happen. So these are the side effect profiles of radiotherapy. So thank you so much for MrMed. Namaste.